away on the Bashment Bay, the information way that'll take you there. Get informed and stay in the news. Uplift your soul and wipe away your woes. Tune into Bashment Bay. Yeah, yeah, yeah.
Hello and welcome to another episode of Bashment Bay TV. I'm your host, Sharon Cummings, along with guys.
Tanya Marie Greaves
and Princess Samuels.
You know what, I realized that the last show we did, I didn't even ask how was your holiday. Christmas went, New Year's went. I'm so sorry. How was it?
Well, mine was exhausting, but fun.
Mine was, I would have to say the same thing, exhausting, fun, and it seems like the next ones are right around the corner.
Mm-hmm.
Oh my God.
Not ready for it yet. Not ready for it yet.
For Thanksgiving, I cried because I didn't, usually my daughter come up, drive up to me, but because of COVID, I told her not to because she would be coming with the kids. So it was just my husband and I, and we did the Zoom thing, but then I started crying in the middle of it.
Oh, God.
That was the first time ever I wasn't with my family.
Mm-hmm.
So I said, for Christmas, I'm sorry, I have to do this. So we spent Christmas together. So I was happy.
Good.
Well, I'm glad you enjoyed it.
Yes, yes.
Whenever I'm with family, I'm fine.
Yes.
Anyway, moving right along, today's episode topic discussion will be on COVID and why there's a mistrust with the medical community. And on that note, we'll be right back.
How do you feel about the vaccine? And like, you have a child and you have a dad that you live with. Like, I know according to statistics, you probably should. However, how do you feel about said vaccine?
I will not be getting that vaccine.
I feel the same
My family
way.
will not be getting that vaccine. And I don't encourage anyone else to get that vaccine.
Oh, okay. And you know, we work in healthcare. Well, I'm probably not, I don't want to say probably, I'm not going to get it. And if they do decide to make that mandatory, I will have to leave my position. They have to get those kinks out.
Yeah, I think it's a bit too soon.
Right. Yeah, so that concludes our TED Talk. And come on in, we will not be getting the vaccine. Thank you.
You know, I can understand why there is a mistrust with the medical community because of the long-standing abuse that we have encountered, not only the Black community, but also Native Americans going way back. So there is that stigma that we can't really trust the medical community. Some of the examples for are the Tuskegee study, you know, where they experimented on 600 Black men for 40 years. You know, when I read that, I'm like, I knew they did the experiment, but I didn't know it was so long.
I didn't either.
You had the Henrietta Locke situation. You had the sterilization of Native Americans and Blacks without their consent. So do you see where we might mistrust the medical community a little, just a little? Tanya?
Yes, yeah. You know, it goes on, you know, it's from what we've experienced in the past and just being afraid. Also, you have those that even those who are educated, you know, they'll look at the numbers and just say, you know, there's not enough representation of Black and brown people in the trials and the testing of these things. So there's the other side of the coin. It's not that they've tested on people, but they're not testing enough on us to give us the real, people feel there might not be enough data there to represent us, and I would even go further to say that it's the lack of knowledge. When you see how quickly this has been rushed through testing, and then it's an experimental, vaccine that's approved for emergency use, and it's not actually approved, FDA approved. It's still in that experimental phase. That just gives people
an emergency approval.
It's an emergency, for emergency use, right? Emergency approval. It gives people a little.
Would you take the vaccine?
If I would take the vaccine?
Take the vaccine? Yeah.
At this time, I would not.
And why?
Well, it's not even really the history of things. It's more the fact that the one vaccine that I've taken the flu vaccine once before. I never got sick before I took it. When I took it, I felt like I was out for the count. I got so horribly sick. I said, never again. I'm not putting that stuff into my body.
I've heard that before.
And so since that time, I've never used it, and I don't really plan on doing it this time. I think the people that take it need to, everybody needs to look at their own situation, look at the facts, why was it approved so fast? It's not because it went through anything, it skipped any steps. It's because the money was poured into it so that they can accelerate the steps, I think the people who typically take vaccines should go ahead and do it if they don't mind, or they wait a little, to see if there are any real long-term effects from it, because they're still finding out new things about old vaccines.
Every day they're finding out new things that happens to individuals. So what about you, Princess?
Well, that's whether I'm going to take it or not.
Yes.
No. No, I don't think so. I need to wait. If I do decide to take it, as you said, emergency, I'd have to be in that state. God forbid. But as it is now, voluntarily just going and taking it, I need some more people to take it first. I need to wait a while. So many times, not only saying that it happens to COVID, but there are other medication. You see the ads on television. If you took this meds over this period of time and you have now developed this, I don't want to be a statistic. I'm sorry. I will wait. I wait.
They have an order, I think, where it's the medical professionals first, older people in nursing homes, and go down the line. You're not over 65, so you would be way down on the waiting list. So I think by then you should have, feel more comfortable in whether or not
need more time than that
or not.
Still need more time. Still need more time than that. As Jamaicans would say, me a big afraid. So I'll wait. I'll wait till then.
You're big afraid?
Yeah. You've never heard that? Big afraid.
Big afraid.
Simply saying I'm a coward.
Even though I'm a Jamaican, I still haven't heard a lot of those terminology. I'm Jamaican. Tanya's Jamaican. You're Jamaican. The only difference is she was born here. I came here young.
Mm-hmm.
So you're the real Jamaican. You're not a Jamaican. What they call it?
Jamaican.
Yes, Jamaican.
Where you lived here permanently, as a child, I was always between countries. But I've always kept in touch with it because I've always loved Miss Lou, always performing little things. So, of course.
I was just going to talk about Deja Vu and Miss Lou, but that's not the topic.
No, not the topic. We're back to COVID.
Back to COVID.
COVID put a brakes on everything.
Yes. We're not able
COVID is the real gangster and the real bad man around here. Simple.
Okay. So, Let's go to a break. We'll be right back.
Hi everyone, this is Grub Cooper from Fab 5 in Jamaica. Guess what? The secret is now out. Bashment Bay Television, talk show, Caribbean style, featuring your host, Sharon Cummings. Check it out.
I would like to introduce someone that has worked in the hospital field for the past 40 years. She works in the she worked in the New York area. She just retired, and she was a financial administrator. So we invited her on the show to give us some insights on why there's so much mistrust with the medical community, because she has been involved with that for many years. So she can give us a little ins and out as to what happens behind the scenes. Here is my friend, Jean Smellie. Welcome, Jean, and thank you so much for being our guest today. How is it in New York?
It is cold. It's a cold day.
Where I am too, but not as cold as New York.
Yes, very
thank you so much for being with us. Could you give us an insight on why there's such a mistrust within the medical community up until today?
The mistrust is so real today in many different facets, because it's not just one thing that's a mistrust. For example, when you have a different health care insurance, you're treated much differently. Mm-hmm. So as an administrator behind the scenes for many, many years, is that I'm in a boardroom with directors of service and administrators. And so when you have a public insurance, is that they talk about treating those patients differently. For example, I remember several years ago, I'm in a meeting and, you know, the hospital was trying to boost the OBGYN services, maternity care. And so the chief of OBGYN, and might I add, this doctor, this chief, a Black doctor. And so he talked about, you know, the Medicaid patients, which is a public insurance, to put them on a separate wing as opposed to the private insurance patients. And to boot, to also give them, after delivery, a meal of filet mignon and lobster. And so I'm sitting there, I'm listening to this stuff. I'm getting more irate by the minute. And I said to him, you know, Dr. So-and-so, what would you propose to give the Medicaid patients? Sardines? And, you know, it was a bunch of laughter as if, you know, again, but these are real conversations that happen behind the scene in a hospital. And wow. So the patients are treated very differently. So that's one aspect. You know, the financial piece is really a real piece, because we do get, hospitals and healthcare do get more reimbursement for private insurance than we do from government sources. So that is a real thing, but it doesn't mean that we should treat our patients differently. But it do occur when that happens. One of the other things that happens, which I can give you a real life example, is, and I know we just had an example of one, a doctor who, you know, died from COVID because of the lack of treatment care. And I can tell you, 5-6 years ago, I'm sorry, 10 years ago, it's been so long now, my daughter, who was studying to be a doctor, had a very, very difficult first pregnancy. And she went from hospital to hospital, and she went to, I have to tell you, the best hospital in the tri-state area. She went to Greenwich Hospital, which, you know, Connecticut, and she ended up in a very renowned hospital in New York City. And she was in the hospital for about 6 months. She was withering with pain. I had to be an advocate. I took off about 3 months from work. And one of the things that they had given her, Dilaudid, it's a narcotic. Mm-hmm. And that's the only thing that alleviated her pain. And I happened to come out of the room at one point when they were making rounds, and they said that they think she's drug seeking because she's asking for this medication. Goodness. They had that in her chart. So it brought back to memory this doctor who just recently passed because she was on Facebook and she said she felt like they were treating her in a way that she's seeking drugs. And this is a real thing. So sometimes your socioeconomic, your financial status, it doesn't matter. As long as your skin is black, you're treated very differently.
Oh, wow. That's crazy.
Yeah, I saw that video and it was hard to watch.
Oh,
And just
gosh.
knowing that she died a few days later.
Yes.
Oh,
yes.
my goodness.
Yes. So again, I, as an administrator in healthcare for a very long time, I really advocate to patients that if they can't advocate for themselves, the families must advocate for the patient. And we have to also know that there are regulatory agencies that advocate for us. We have people in the hospital, patient rep, that advocate for the patient. Oh, yeah. And regulatory agency. The only way I was able to get my daughter the treatment that she needed was to cite certain regulatory agencies that I'm going to call them if they don't treat my daughter in the way that she should be treated. So there's a lot of whether misguided information or lack of information, our Black community do not know. I know we cite these cases, and that's the only thing most of the time we talk about, but there's so many other behind the scenes things that we need to arm ourselves with so that we can be more educated as a consumer, to the healthcare system.
Yes, you've touched right on something that we were talking about earlier, is that lack of knowledge or even just incorrect knowledge, you know. And I mean, I've seen it, and I think it's just because my mom's been a nurse, and to be able to take care of my aunts who go in the hospital or whatnot, because she has the terminology and knows what to say. That's how she's able to get things done. And they all look at her with the one eye, like, who are you, kind of. But you have to know these things, and the only way we feed ourselves so many different things, but we don't feed ourselves the knowledge that will help us get through this system that we're in, whether it's healthcare, education, whatnot. So educate ourselves. That's what we need to do on all of these things.
Absolutely.
Before my mom and my dad passed, and whenever they would go into the hospital, I mean, I'm a quiet person. I don't start anything. You know that, Jean?
That's right.
But every time they were in the hospital, I had to go off because they treated them like they were off the street.
Yes.
I'm like, they're not homeless. They have a family. And I always end up going to the administrator.
Yep.
After that, they're treated like kings and queens. But if you don't have a voice, to be there for you, they treat you any way they feel like it. I had to ask one of these nurses, do you have parents? Do you think you're going to get old one day? Would you like to be treated like this? So it's very difficult, with the medical community. I think, I don't know, they need retraining or something. I don't know. But it's not easy dealing with them.
Yeah.
Princess?
Yes. Like Jean said, you have to have an advocate. When you're in the hospital or even a facility, anything that is medically related, if they know for a fact there's no one there to speak for you, you're treated differently. I know this because I've been in the field for a number of years and I've seen this. And the ones who have the regular visits, there's a different face that is shown to them. And that patient or that resident is treated according to the visitors and the knowledge of the visitor. If they're there and they're aware of certain things, then you can tell them certain things. Or likewise, say, I know my rights and I will call so-and-so. That's the only time people will be on their toes and doing what they're supposed to be doing. You said they treated your parents as if they were homeless. But I say whether they were homeless or not, they should be treated equally.
I say that because my dad was in the hospital. We left there probably about 3-4 o'clock. They said they had a bed. Okay. So it's okay. They'll have a bed. We were back by 8 o'clock in the morning, and my dad was still in the same place.
Yes, they do that.
No covering,
Yes.
no nothing. So that's why I went off. I'm like, really?
Another thing too,
But
I must say,
no one deserves to be treated badly.
no one. But it's not only on the nurses themselves. And I'm saying this to say that they're given a certain time in which to complete admitting them and everything, and you must have this covered and documented before you leave, and you're not given extra time. Some facilities, some places, if you can't do this within the given time, you stand to lose your job. So they either take shortcuts, and things that should be done are not done because they need this paycheck. So, I mean, every area of that medical field, they need to go through every area. Everything needs to, be adjusted, because there's so many things I've seen that could be dealt with differently. Lives have been lost as a result of negligence. And the lack of information, you're given this and you're rushed out. They're not even giving you the treatment that you need if you go to the emergency room. They shortcut everything.
Would you take the COVID vaccine?
Yes, I would take the COVID vaccine. When I, look at the pros and the cons, in the height of when New York went through this, and even though I'm not clinical, but as an administrator, I was part of every hospital set up a command center when disaster things like this happen. And just hearing the numbers every day, looking at the WebEx, at the folks, the clinical folks in the conference room, look like they're about to just drop, I'm telling you, drained. Listening to the number of deaths per day. My colleague who, I guess she currently still is in charge of ensuring that the death certificates are completed. Whereas she would have completed maybe 10 per month, she was completing 10 times that amount per month, weekly. Her staff who was doing it, she had to call in one of the psychologists in the hospital to speak to them because the families were coming in droves. So I say that to say, going through what we went through in New York and being that close to it, waiting on a respirator, I'd rather take my chances with the vaccine. And thank God, I'm pretty much healthy, even though, that I've proven, healthy people have gone through this. So I don't want to rest on my laurels with that. But I'd much rather take my chances with the vaccine. My daughter took it yesterday, and when she was finished, she called us, I said a prayer, and I just continued to pray. And her second dose, is coming up in, a couple of weeks. And that's my feeling about it. I mean, initially I was very adamant, oh no, I'm not taking it. But, New York was in a good place. The numbers are rising because of the holidays and people traveling and people with families. Right. It's just, so definitely I would take it.
I have a question for you, Jean. So so the mask and the total lockdown is what you would recommend?
That's what I would recommend. And we, do the same thing everyone is doing, cleaning down, wiping down and stuff, but you can just never, a matter of fact, for the first time today, I took the COVID test. When I was working, I just retired in June, I took the antibody test in June, the blood test. And it's the worst thing in the world, I'm telling you. It's one of those necessary evil because we all decided to take it. I mean, a couple of my family members that live here, they took it like twice already. And it is the worst thing, but it's just one of those things that I believe everyone should do. For example, I have a friend that is still working in the hospital, and she worked in the dental clinic, and she says she's not taking it. Her reason for not taking it, and I guess everybody's reason is different, and I'm not going to say it doesn't make sense. It makes sense to her. It may not make sense to me, but she said, if I take it and I'm asymptomatic, I'm going to be worrying myself waiting to see if the symptoms will appear. So she'd rather not take it. So when you speak to different people, and this is just a test, this is not even the vaccine. So even the test itself, people have different views on it and reasons why they're not taking it. So the vaccine, some people that's, you know, my age group, that they're not taking it. They're waiting to see in terms of the greater percentage of the population take it. And then
That's all
they
I
have
need.
the herd immunity, then they'll take, then they don't have
That's
to.
sound like Princess.
Really?
Yeah, that's what she just said.
But you know, one of the things that I think is there's so many details to the vaccine. You know, the fact that there's two, the fact that you two doses, the fact that you have to wait, you know, 21 or 28 days depending on which one you take, or which one you get. Then you got to wait some more time for it to really affect. And the fact that it's not going to protect you from COVID, it's just going to hopefully protect you from the disease, which is the symptoms and those types of things. So, you know, it's hopefully to mitigate some of the deaths and those types of things, but you could still get COVID with it. And I think without the knowledge, people are going to have that that false confidence that they can be out and about
And
doing
doing
whatever they
anything, yeah.
want, you know, but they'll be affecting other people who may not have had the chance to take it yet because they're not in line yet, you know, or that they've been or that they just didn't take it because of whatever reason they might have, you know. So I think that again, if we need to all make our decisions. I said it before, kind of just look at the facts, look at what it is, and make your own decision as to what you need to do. But in the end, you still need to hopefully cover your face if you're going out. Not stay out in crowds, in big crowds, people that you don't really know, you know, for long periods of time if you don't need to, you know. Also, I'm a proponent of not living in fear. So, you know, life has to go on. So you got to look at all those things and make the decision as to whether or not you're going to take it.
Right.
A lot
I
to
stay away
think
from the
about.
test as much as possible. I don't want anything up my nose.
I prefer have it up my nose instead of my throat.
It's true.
I
And
don't
you-
want my throat either.
Everyone just have to stay safe, but again, you know, not be afraid. Princess think I'm afraid to go out. I go out. I go out. I'm careful.
I want to ask Jean one question before she
Yes.
goes. Is there any truth to that if you have had COVID and have survived it and have developed the antibodies, you cannot get it again? Is that true?
I have not. That case that I saw in, I think Las Vegas, the young man that had it and 40 days later, he had it again and even worse. But they've cited a couple of cases where people have, you know, got it again for the second time and the symptoms were worse. So
Wow.
again, I personally would not rest on my laurels. God forbid, if I had it, to say I wouldn't get it again. For example, they have information that came out to say if you have O positive blood type, less chances of you getting it. Nothing is absolute. They have not said if you do this, have this, you'll not get it. I have O positive blood type and I'm still taking all the precautions like everyone else. It doesn't mean anything because, you know, they're still studying. I mean, like Tanya said, they're still studying this thing. They really don't
right.
know.
They don't know it. Yeah.
They don't know everything yet. You know, I mean, it's fairly new. It's not even a year old. They're still learning as they go.
Right.
So this is why, you know, you personally have to be careful. Wear your mask, wash your hands, and social distance is very important.
Very, very important.
Because they tell you one thing today and then, oh, by the way, no. Like initially it was no mask, right? And then it's like, wear your mask.
Right.
So, you know, better be safe than sorry.
Right. Absolutely.
That is why I'm afraid to take the vaccine right now. I keep hearing different things each time. So When they run out of things to say, I'll think about it.
Well, just stay safe, Princess.
I will.
Jean, thank you so much. We've learned so much.
Thank
Got
you.
a lot of information. So thank you so
Thank
much.
you.
You're
And I
welcome.
hope
Thank
you'll
you.
come back again.
Yes, anytime. Thanks for inviting
Okay.
me. It was a pleasure.
Thank you.
Thank
Thank
you.
Up next, after this break, will be Teen Talk with host Gabby.
Hey everyone, this is Jamal, one of the original cast members from the Deja Vu Theater in Atlanta, Georgia. Just want to give a big shout out and congratulations to Bashment Bay Television. Welcome back. We've missed you. Definitely wishing you much success in the future. And hey, maybe I'll get a chance to come on board. Take care.
Hello everyone, my name is Gabby, and I am one of your hosts for the Teen Talk segment. First off, I want to thank Ms. Sharon for this amazing opportunity. But let's get right into this topic because I'm actually very excited to talk about it. Today's topic for Teen Talk is trust. And now, a lot of people don't actually know what trust really is, so I took the liberty of looking it up. And from what I got from my research, what trust really means is if you trust someone, you believe that they are honest and sincere and will not deliberately do anything to harm you. For instance, I trust you completely, so-and-so said. If you do not trust something, you feel that it is not safe or reliable. And I completely agree with this because for me, what trust is I can put my faith in someone and I know that they won't deliberately hurt me or use what I've told them against me. Now, I went around my school and I asked a few of my schoolmates and my colleagues, what do you think trust is? And I asked my friend Caitlin, and she said, and I quote, I believe trust is when I can talk to someone that does not go to my school or cannot see inside my home and tell them what is going on with me personally and not have them hurt me or use the information I have given them against me. And I asked her a little bit to elaborate a little bit on what she said, and she said, trust to me is when I can talk to someone and I know and I feel safe talking to that person. And I completely agree with her, and a few other people said the same thing about trust. When they can actually talk to someone, they can feel safe talking to that person. Now, I actually took the liberty again of going to ask my guidance counselor, what do you think trust is, and do you think trust is a big problem in middle schools and high schools? And she actually said yes, and I asked her again, can you elaborate on what you mean by that? And she said, in this day and age, kids my age and teens are looking for a safe place, a place or a person that they can talk to and put trust in them. Personally, I think trust is a big thing for teens and parents because if a teen cannot trust their parent or guardian, there is something wrong and there needs to be more communication between the two because lack of communication also leads into depression and anxiety, and kids nowadays have a lot of that, and a lot more kids now are coming down with anxiety than 2 years ago, and that's really concerning. And that's what my guidance counselor had to say about the subject of trust. Now, I want to go into a little sidetrack and say trust is not instant. You can't talk to someone and be, oh yeah, I trust them completely. You have to build up you have to start with a wall and slowly deduct bricks from that wall, because if you immediately trust that person that you just met them, you don't know, are they a bad person? Have they done bad things? Have they hurt someone deliberately in the past before? Trust is something that you build, and trust is something that does not come immediately. Now, if someone were to trust me instantly, I'd be very appreciative, and I wouldn't deliberately try and break that trust. I've had a few friends in the past that I've trusted that have completely just broken that trust and damaged me personally, because I was like, why would you do something like that? And you knew I trusted you, and you knew I put my faith in you. So I thought this topic was very interesting, because a lot of teens and people that I've interviewed at my school are going through things like this. I had a girl, her name is Amy. She said she does not trust a lot of people, which is also a reason why she doesn't have a lot of friends, because in the past she's put her trust in family members and friends, and they've completely shattered it. And she also told me she has anxiety because of stuff like that, stuff in the past that had happened to her. I asked her if she could tell me what had happened, and she said no, and I respect that decision, because it's her business, and if she does not want to tell me, she doesn't really have to, right? So she was explaining it to me, and I was listening, and I was writing down, and she was saying past experiences can affect a lot of your decisions in the future, because say you trust someone in the past and you stuck by them for so long, and you guys have talked about so much, and then all of a sudden they're just gone, and they've told everyone what you personally said, I trust you with this. I trust you with this information. And I have a teacher, my peer counseling teacher. She also got a say in this, because I asked her, and she said, as a peer counselor, you're supposed to trust everyone, even if they're a bad person, if you don't know where they come from, what they've done. You have to have trust and put your faith in a person. Why you have to do this is because as a peer counselor, when you're talking to people, you're supposed to listen, and it's kind of hard to listen when you know someone's background. You know, oh, they're a bad person. I don't trust that person. You can't do that as a peer counselor. And that's what we're learning. A lot of what peer counseling is, and a lot of people actually don't know this, peer counseling is like a psychologist or a therapist. We listen to people, and they put their trust, their life, I wouldn't say life, they put their faith in us with things that have gone or happened to them, and we have to keep that secret. We have to be that pillar of trust. Now, I did some more research, and I was looking at different schools that have had that have either been like shut down or closed due to issues like that. And my school has actually gone through something through trust like that. I don't have the permission to disclose that information, but I do know, because one of my teachers have told us about it. A lot of trust issues happen with teens that have gone through some kind of relationship, a boyfriend, a girlfriend, anything, not being accepted by someone that they trusted, especially now with LGBTQ and people actually having the pride and the confidence to come out and say, hey, I like girls, or I like guys. A lot of family members who have people like that have completely either disowned them or just stopped talking to them because of that trust. And that's where a lot of depression comes from, as I already said, because trust is a really, really big thing. And if you don't have trust, then you're kind of shattering your life in a way. And I'm not saying that everyone should immediately trust people off the bat. You should not do that. You should, as I said, work your way building up that trust. Because if you just immediately jump into a relationship, you don't know where that is going to lead you. And I'm going to take this from my grandfather, because even though I pretend I don't listen to him, I'm actually listening. And I wish when I was younger, I listened because
Trust. We know how important that is. So, what do you say to that, Tanya?
I mean, you know, whether it's trusting the people around you, trusting your friends, trusting the medical community, you know, and, you know, having trust in God, trust is very strong in our lives, in all of our lives, you know, and it has a lot of weight.
Mm-hmm.
It certainly does. When you have a friend, you know, if it's a very good friend, like Jean and I have been friends since high school.
Wow.
We might not speak every day, but the trust is there. You know, we were always able to trust each other, trust
That's
in your
awesome.
husband, trust in your boyfriend. You know, those things are very important. And family trust, most of all, is very important. Would you
Yes.
say?
Well, I guess I trust in the friend, the family. Be careful on the little boyfriend and the husband part, but we leave the rest up to chance.
Oh, goodness. Well, whatever it is, we got to own it, right?
And you gotta own it.
On that note, we are going to bring to you our entertainment for today.
Ooh.
Straight from Jamaica, singer, songwriter, and actress Zanni will perform Own It.
That's right. Own it.
Party!
You could be the one I call my one and only. I could be the one you tell all your homies. Shawty got it right, you making me want it. Tell me what you like, I'll tell you what annoy me. If you treat me right, I'll make you adore me. Speed it up, slow it down, however you want it. Bibs, it's on your mind, I can tell that. Look, I know all too well. We've been friends for a while now. How can I make you believe my love is all I would give? What makes you so scared of me now? Let me tell you this. You take me up, you tear me down, baby. All this run around got me tired and faded. Think you got it all, but let's be real. You know you never find another like me. You could be the one I call my one and only. I could be the one you tell all your homies. Shawty got it right, you making me want it. Tell me what you like, I'll tell you what annoy me. If you treat me right, I'll make you adore me. Speed it up, slow it down, however you want it. Big ass serious. Do you remember all the times when I came to your rescue? All the times when the streets upset you? Tell me how you can't separate you. Would you prefer if I stood back and watched them take you? Doing time for something that ain't you. Them other girls don't have you back like I do. And it's driving me crazy, 'cause I wanna know, gotta know, can you see this through, baby? You could be the one I call my one and only. I could be the one people, wagwan. My name is Zanni, straight from Kingston, Jamaica, and I'm here to share with you today some of my music. You just watch on it, and you can check out some of my other stuff online at Zanni Music, Twitter, Instagram, Facebook, all straight across the board. YouTube, Zanni Vivo. Check me out. Enough love. Mwah.
Thank you so much, Zanni. That was awesome. We hope to have you back soon. Well, our next episode will be February 7th, and we're going to have our pre-Valentine's Day show because we take this show every 2 weeks. So the next show would be after Valentine's Day. So we're going to have our pre-Valentine's Day show, which is going to be awesome. You do not want to miss it. Tanya, would you be performing for us? I want a song. I want a song.
Oh, please, please.
Yes, I want a song.
Okay,
We have all actresses here, okay, and singers, talented people, except for myself. I can't sing or anything. But we have talent, deja vu talent.
Yes,
So,
deja vu talent.
Will you be performing?
We'll see about that. I'll have to go into my repertoire.
Okay, I'll bother you up until then, okay? So I hope you will come back and join us here on the Bay. Thank you so much for watching, and we'll see you next time.
Please remember to subscribe. And if you would like to be a guest on our show, please contact us at the information below. Also, if you've heard anything that you have questions about or you have information on, please be sure to comment, put any links that will help educate everyone. What we want to do is make sure that we're getting the proper information out. So, and this information changes and there's so many different places you can grab it from. So, be a part of it, be a part of the community and share what you know.
Exactly. So until next time, thank you for watching Bashment Bay.
Bashment Bay, Bashment Bay.